World TB Day was observed at the Directorate of Health and Family Welfare, Kohima, under the theme Yes, We Can End TB, with Kikheto Sema, Commissioner and Secretary, Chairman, Executive Committee NHM, as the special guest on Friday. The program was chaired by Dr. Tiasana Pungoner, State TB Officer, NTEP, Medical Consultant, World Health Organization, Dr. Colin Z. Sono, and NHO Mission Director Dr. Ritu Thur spoke on NTP's journey and TB Day's theme respectively. Dr. Ritu Thur said a strong political and administrative commitment is required and uninterrupted supply of TB drugs and a better sensitization to achieve the goal of eradicating the disease. He also said that he has committed to look after 5 TB patients for 6 months.
At this very moment, all over Nagaland, led by our 11 DPOs, even in Kohima at CMO office, is going on. So today, the celebration is also including the whole of Nagaland. I happen to be the CMO, acting CMO of Dimapur, when the first COVID epidemic came. We were very new, we didn't know what to do, we were in a big mess. We used to have every day, morning, evening, VC with government of Nagaland. All the hierarchy was in Chief Minister and Chief Secretary's office. Everybody was scared to come down to Dimapur. And every time we get gully. Do that, do this, why you didn't do this, why did you have this? We had lots of pressure, especially from the community because of the lockdown, from the villagers, all were against us. That's the time. God sent one person to Dimapur. That was Kikheto. In the midst of our confusion and all ups and downs, Sir Kikheto was sent as the leader from government of Nagaland. And he came down, from the day he came down, he stayed with us. That's how I know how initiative and dynamic he is. Madam Devi today, you all know, from the day she took over as PD, she's a motherly figure, very quiet, but she leads from the front. You will not see her moving around, she's always missing or she's in the room quietly, but our development so far, she's taking us in the right direction. Thank you, ma'am. Our mission director, Dr. Ritu, welcome. When he was a joint director, he was a very happy man. He used to smile, joke, run around. After he became MD, he always said, haggard face. In the last 4 or 5 months, he has become so old. All the headache is on his head.
Well, we remember this day and celebrate today because of one rock organism called Mycobacterium tuberculosis. In the 18th century, TB was also called the robber of youth because it had become an epidemic with a mortality rate of 900 per lakh population per year, and more so among the young people. It was only on the 24th March 1882 that Sir Robert Koch announced the discovery of the TB bacillus, and this day we dedicate and celebrate worldwide, that is the World TB Day. You are aware that the TB bacillus can survive in various environments and can develop resistance to various drugs. Typically, it affects the lungs, but it can affect any part of the body. Remember, anyone can get TB. As per the global report 2022, India has 3 million new cases of TB, which accounts to 28% of the global burden, and every day about 800 people are having new TB cases in India. Our country also contributes to 35% of the global TB deaths, which means more than 1,300 people are dying every day because of TB. We also contribute 26% of the drug-resistant TB cases and 8% of TB HIV cases in the world. It is estimated that 40% of the 1.4 billion people in India are infected with latent TB infection, of which 5 to 10% of these latent TB infected people, they develop into active TB. I want to share the journey of the TB program. 65 years later, after the discovery of the TB bacillus, the first antibiotic called the streptomycin was discovered. And to make TB-free India is committed to end TB by 5 years ahead of the global SDG targets. The targets were to reduce TB deaths by 90%.
460 to 350 BC, he described tuberculosis as a phthisis, also called wasting away of tissues. And also the tricks, those days that named the TB as a curse, is a king's evil. And in our Rig Veda, it is mentioned as Yashma, tuberculosis. As another famous writer, Aristotle, described the TB captain of the ship of death. Number one strategy is strong political and administrative commitment. This is the most important core. Any activities, any project, any program, without the involvement, without the political and strong commitment, will be not in a position to carry forward. So our state, our program, we have decided to take the number one strategy is strong political and administrative commitment, so that we have financial sustainability, and thereby we will get uninterrupted TB drug supply, diagnostic facilities, research facilities, and so on and so forth.
Kikheto Sema, while exhorting the gathering, said that TB remains one of the world's deadliest infectious killers, and the global efforts to combat TB have saved an estimated 66 million lives since the year 2000. However, the COVID-19 pandemic has reversed years of progress made in the fight, and TB deaths increased in 2020 and 2021. He said that the state's strategic plan to eliminate TB in Nagaland by 2025 has been drafted in alignment with the national strategic plan. He further added that with the involvement and support of line departments such as administration, municipality, social welfare, rural development, labor, tribal affairs, IPR, etc. to fight against TB and for effective functioning of the program, and the churches, NGOs, private practitioners, families and individuals will further strengthen the program initiatives and to achieve our goal in eradicating TB. The Commissioner and Secretary also visited NHAK and met 6 TB patients on behalf of the department.
In fight against this COVID, and let us work to eliminate TB and to uplift the poor people, to help the poor people, so that we will be able to achieve our goal. TB remains as one of the world's most deadliest infectious killer. I'm told that the victim of TB in a year is about 1.5 million, and global effort to save the TB is estimated to the tune of about 66 million lives every year. However, as we all know, and as Tia Sanap has stated, we had a good time together during the first wave of COVID and second wave, and I always used to mention that the sun rises from the east, but the corona rises from the west. So we were all asked to be stationed at Dimapur, and we also agreed with the statistic that COVID pandemic has revised years of progress made in our fight against TB, because the TB death has increased during the COVID pandemic, particularly in the year 2020 and 21. With my officers, and I would like to thank all of you for giving support to me and my team, and together we will be able to achieve not only TB, not only malaria, but all the activities we will be able to achieve if we are together as we, not I bring illness, we for wellness, and I think we should look forward to achieve more in the days to come. It's about 140 years ago, on 24th of March 1982, Dr. Robert Koch announced the discovery of tuberculosis, and that paved the way for diagnosing and curing tuberculosis disease.
Meanwhile, a recovered TB patient Anjali shared her personal journey on how she became a TB champion.
The most important person for to get through this. Today I would like to be the example for all the TB patients that I have fought against TB, and I'm pretty sure that everyone there suffering through TB will be able to cure like how I did. Thank you.